Hi everyone, welcome to our channel. In this video, I'm going to explain about the paracetamol, in what conditions we'll use paracetamol and in what conditions we won't use, what is the dosage, how it works, metabolism, side effects and drug interactions. Before that, if you have not subscribed our channel, please subscribe and don't forget to place the bell icon. Now comes the topic, what is paracetamol? Basically, paracetamol contains acetaminophen. It was first synthesized in 1878 and from 1883 it was widely using this drug. And WHO recommends paracetamol as the first line of drug and the most commonly used drug. Next, in what conditions will use paracetamol? Generally, paracetamol is an analgesic and antipyretic. Analgesic means it is used to reduce the pain and antipyretic is used to reduce the fever. So, paracetamol is used to treat mild to moderate pain like muscle pain, back pain, headache, menstrual pain and toothache. Next comes the question, in what conditions we won't use paracetamol? Paracetamol won't work effectively in moderate to severe pain. In these conditions, we'll combine paracetamol with opioid drugs like ibuprofen, diclofenac and tramadol. And in conditions with swelling also, paracetamol is not the drug of choice. Next comes the route of administration. Paracetamol is basically administered as oral, intravenous and rectal route. In oral administration, paracetamol is available as tablets, capsules and syrups. In tablets, paracetamol most commonly prescribed as Dolo 650 and in syrups, paracetamol is prescribed as crocin, calpol and Tylenol. Next comes the dosage of paracetamol. Generally, when we take a paracetamol in the form of Dolo 650, the dosage should not exceed more than 4 grams per day. It means whenever we take paracetamol, it should not exceed 1 gram per dose. Generally, paracetamol is advised QID. It means 4 times a day. Whereas in children, the maximum dose of paracetamol is 720 milligrams per day. And the maximum recommended dosage in children is calculated by age as well as weight. Next, when comes the age, if the child is 0 to 3 months of age, we can give 1.25 ml of paracetamol syrup per dose. If the child is 4 to 11 months, we can give 2.5 ml. And 1 to 2 years of age, we can give 3.5 ml of syrup. And if the child is 2 to 5 years, maximum dose of paracetamol per dosage is 5 ml. Next comes the weight. If the child weighs less than 10 kg, maximum recommended dose is 7.5 milligrams per kg. If the child is greater than 10 kg, the maximum recommended dose is 15 milligrams per kg. For example, if a child weighs 10 kg, the maximum dosage we can give is 15 into 10, 150 milligrams per body weight. So, a person weighing 10 kg, the maximum dosage is 150 milligrams. Next comes the question, how it works. To understand this, we should understand how we'll get pain as well as fever. So, whenever we have infection, or whenever we got injured, our cells will get damaged. These cells release arachidonic acid. The arachidonic acid combines with cyclooxygenase to release prostaglandins. These prostaglandins helps in the occurrence of fever, pain, etc. So, whenever we take paracetamol, this paracetamol mainly acts by inhibiting the prostaglandin synthesis. So, whenever the prostaglandin is not synthesized, generally there's no fever as well as there's no infection. This is the main mechanism of action of paracetamol. Next comes the metabolism. So whenever we take paracetamol, 2 to 5% of paracetamol is excreted through urine. However, remaining paracetamol is metabolized in the liver. It means it enters the liver, and cytochrome P450 enzyme in the liver metabolizes this paracetamol into NAPK. NAPK is nothing but N-acetyl P-benzoquinonamide. NAPK is very toxic. So, to reduce the toxicity, an enzyme called glutathione converts this NAPK into non-toxic form and it's excreted. So, most of the paracetamol toxicity mainly depends here only. If NAPK is accumulated, paracetamol toxicity occurs. Or if glutathione levels are reduced, paracetamol toxicity occurs. I'll discuss later in the later slides. Next comes the side effects. Very rarely we'll get side effects by administering paracetamol, but the most common are rashes, nausea, vomiting, constipation, abdominal pain. These are all the side effects. Next comes the question whether we can use paracetamol in pregnancy and lactating mothers. Yes, we can use paracetamol in pregnancy and lactating mothers because even though paracetamol tablet passes through the breast milk, the toxic effects are very less. So paracetamol is safe in pregnancy and lactating mothers, but before using, just take a medical consultation of your doctor and use paracetamol. Next comes the drug interactions. Generally, we can use paracetamol in any conditions, but whenever you're taking anti-epileptic drugs like carbamazepine, phenytoin, be cautious because when we take paracetamol along with this anti-epileptic drugs, there can be accumulation of NAPK. So it may lead to paracetamol toxicity. And be cautious when you're using paracetamol in combination with oral anticoagulants like warfarin. It may lead to increased INR values and may lead to increased bleeding. So be cautious whenever you're taking anti-epileptic drugs as well as the oral anticoagulants. And the last one is whenever you're old age, poor nutrition, and when you're fasting, paracetamol toxicity may occur because in old age, poor nutrition conditions, and in fasting, there is decreased glutathione levels. Because of the decreased glutathione levels, there is increased accumulation of the NAPK, thereby resulting in the paracetamol toxicity. This is all about the paracetamol tablet. If you like the video, please share with your loved ones and subscribe our channel. Thank you.